Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the world and return the knowledge to the world. Motto of my life is learn, earn and return. As I have learned a lot, earned a lot, now is the time to return a lot to the world. Topic of today is rheumatoid arthritis. The introduction is that rheumatoid arthritis is a long-term inherited autoimmune arthritis primarily affects hands and the feet joints. The joint destruction and deformities are progressive in nature. The term rheumatoid arthritis is based on the Greek for watery and inflamed joints. Here, body's immune system attacking the joints results in inflammation and thickening of the joint capsule, synovitis of the multiple joints. It also affects the underlying bone and the cartilage, which results in warm, swollen, and painful joints. The disease also affects the other parts of the body besides the joints, and diagnosis is on the basis of person's sign and the symptom. Now, just look at the joint, how the joint is being formed. So, the first is the epiphyseal bone, and the other is also the epiphyseal bone. Here, there is anthesis where this ligament is attached, and here it is the articular cartilage between the joint, which does allow the movement and it works like a cushion in between the two bones. Now, here is the muscle which is attached at the bone, and here there is synovial cavity, and here there is the bursa which just protects the joint, and after that, just after around the synovial cavity, there is a capsule, joint capsule, and synovial lining. And here is the tendon of the muscle, and then anthesis is the part where the tendon of the muscle is being attached to the bone. So this is the normal structure of a joint. There are certain changes which are going to occur in osteoarthritis, and that is in synovial cavity and in the cartilage, which we are going to discuss now. So, X-rays and the laboratory testing will help the diagnosis or exclude the other diseases with the similar symptom. Other similar diseases include systemic lupus erythematosus, psoriatic arthritis, and fibromyalgia, among others. Rheumatoid arthritis affects 0.5 and 1% of the adults in the developed world, and its onset is usually in the middle age. Female and the male ratio is 3 to 1, so the female are affected more. Rheumatoid arthritis is a chronic disease and rarely spontaneous remission may occur. You don't need to have any treatment. Natural course is persistent symptom, progressive deterioration of the joint structure, leading to the deformities and the disabilities. Now, here one can see the different joints of the hand and the knee and the fingers and the knee. Uh, this is the wrist joint, so the knee joint and the finger joints, these all are involved in the rheumatoid arthritis. Now, history of the rheumatoid arthritis is it was first recognized description of the rheumatoid arthritis was in 1800 by a French physician, Dr. Augustin Jacob Landry Bouvier in 1772 to 1840. The name rheumatoid arthritis was coined in 1859 by British rheumatologist Dr. Alfred Baring Garrett. Historic treatment for rheumatoid arthritis included rest, ice, compression, and elevation, which is abbreviated collectively as RICE. Apple diet, nutmeg, some light exercise every now and then, nettle, bee venom, and copper bracelets were also being used as the part of the treatment. Rhubarb diet, extraction of the teeth, fasting, honey, vitamins, insulin, magnets, and electroconvulsive therapy was also in the past considered the treatment of rheumatoid arthritis. Now, the epidemiology, rheumatoid arthritis affects 0.5 and 1% of the adults. People, onset is rare under the age of 15 and it can begin at any age, but the peak onset is 4th or 5th decade for women and 6th to 8th decades for men. That is, earlier in the woman is because of the menopause and the osteoporosis related with that. Incidence rises with age until the age of 80 and women are affected more 3 to 5 times than the men, and that is, I think, because of the menopause. Now, there are certain risk factors. Rheumatoid arthritis is a systemic, whole body autoimmune disease. These risk factors are of 3 types: genetic, environment, and infection. Among the genetic risk factor, mostly HLA system, which controls the recognition of the self versus non-self molecules. As I have told you already, that it is autoimmune disease. Body's own antibodies are not able to recognize the self antigen and they consider it as the foreign antigen and they start the inflammation and the reaction. So this is the basis of autoimmune disease. Here in genetic, the system is unable to recognize the self antigen. A family history of rheumatoid arthritis increases the risk 3 to 5 times and genetics account for 40 and 65% the cases of the seropositive rheumatoid arthritis. Only 20% of people for seronegative rheumatoid arthritis has been seen. The another risk factor is environmental, and smoking and silica exposure are considered to be notorious. Similarly, modest alcohol consumption is said to be protective in nature to avoid the rheumatoid arthritis. Now, the third risk factor is infection. No infectious agent, no disease is linked with rheumatoid arthritis, but it is said to be that periodontal disease is associated with rheumatoid arthritis. So, the different factors one can consider the genetic factor and the certain hormone like testosterone, estrogen, and menopause causing the osteoporosis is also responsible. Similarly, age 4th to 5th decade, smoking also provoke rheumatoid arthritis. Similarly, stress, obesity, overweight, gut, diet, and early life factors, all these are going to cause the rheumatoid arthritis. Now, the pathophysiology of rheumatoid arthritis. Rheumatoid arthritis primarily starts as the cellular activation leading to the autoimmunity. I have told you that it is autoimmune disease and immune complexes in the joint and the other organs are formed. The initial site of the disease is synovial membrane, so causing synovitis, where swelling and congestion lead to the infiltration by the immune cells of the body. There are three phases of progression of rheumatoid arthritis. Number one is non-specific inflammation. There is abnormal immune response which becomes permanent and chronic. Genetic factor interact with the environmental risk factor for the rheumatoid arthritis. Cigarette smoking in males and in females, childbirth, and the hormonal medicines are responsible for pathophysiology. Now, non-specific inflammation, the first I have told you already, in acute phase, effusion and the other manifestation of inflammation. Later, there is organization occur causing the fibrous ankylosis, citrullinated fibrinogen bound by the antibodies to the citrullinated peptide ACPA, that is anti-citrullinated protein antibody, or also called anti-CCP antibody, is being produced. The other factor in pathophysiology is amplification in synovium. Once generalized abnormal immune response occurs, it takes several years before the symptoms of the rheumatoid arthritis occurs. Plasma cells derived from the beta lymphocytes, these produced rheumatoid factors and ACPA, that is antibodies to citrullinated peptide, which is the hallmark for the diagnosis of rheumatoid arthritis. Now, here one can compare the healthy joint with rheumatoid arthritis joint. Here one can see in the healthy joint the synovial membrane, and here is the capsule, and here is the cartilage, and these are healthy joint. But here in case of the rheumatoid arthritis, one can see the synovial membrane hyperplasia as compared to the normal synovial membrane. Then there is bone erosion here. One can see the sash like appearance of the bone, that is bone erosion, and here it is smooth. Then there is the destruction of the cartilage. One can see the destruction of the cartilage and smooth lining of the cartilage, and here one can see the smooth cartilage and the. Now there is pannus formation here in rheumatoid arthritis, and which is not here in case of healthy joint. So one can see the pannus formation, that is just here between the joint, between the two bones, and that is causing the problem. And here it is, one can see that between two ends of the bone, the pannus formation. Now, continuing the amplification in synovium, these activate macrophages and the complement binding, causing the intense local inflammation in the synovium, which lead to the edema and the vasodilation. The third component in the pathophysiology is chronic inflammation. The disease progresses by forming granulation tissue at the edge of the synovial lining, which is pannus. I have shown you already in the previous slide. This pannus erodes the cartilage, bone, ligaments, and the tendons of the joint. The synovium thickens, cartilage and the underlying bone disintegrates, and the joint deteriorates. So here one can see the lymph node producing the T lymphocytes and the B lymphocytes, and one can see the T lymphocytes are going to make the B lymphocyte, and thus T lymphocytes are going to activate the B lymphocytes, which are going to produce the rheumatoid factor, and that is autoantibodies. And here one can see that this T lymphocyte is going to activate to form FCS, which is basically the fibroblast like synovium, and here it activates the MB, that is macrophage, and also the other cells like FTC. All these cells which have been produced by the activation are able to release the certain cytokines and MMTs, prostaglandins, and nitric oxide, but mainly it is TNFA, tumor necrosis factor A, and IL-1, which are responsible for causing most of the destruction in case of the rheumatoid arthritis. Other cytokines are also responsible, but mainly it is the TNF and IL-1. Now, continuing chronic inflammation. Tumor necrosis factor alpha, as I have already shown you, is a pro-inflammatory cytokine, regulate inflammatory response in the rheumatoid arthritis. And we are going to neutralize this tumor necrosis factor as the part of the treatment in case of the management also. Rheumatoid arthritis is a form of type 3 hypersensitivity reaction. Besides TNF, other cytokines are involved, as blocking the TNF alone is not beneficial, so not for all persons and all tissues, particularly the lung disease and nodules, do not respond if we are going to block the TNF. So we are going to block the other factors which are responsible for causing the rheumatoid arthritis, and these cytokines are IL-1, IL-15, IL-6, and IL-17. That is beneficial to block all these so that one can stop the changes in the other organs of the body besides the joints. Now, some people come in your life as the blessings, and some people come in your life as the lesson, because they give you that lesson by which one can learn a lot, and if there is helpful lesson, so that is a blessing. That is the saying of the great lady of the world, Mother Teresa. Now, the sign and symptoms of the rheumatoid arthritis. Rheumatoid arthritis primarily affects the joint. Symptoms come on gradually over weeks to months. Primary symptom is pain and early morning stiffness, which is always more than 30 minutes. And this is very important point in the diagnosis of rheumatoid arthritis also. It mostly involves wrist, hands, knees, and ankle, with some joints typically involved on both sides of the body. Same joints are involved on the both sides of the body. Gentle movement may relieve symptoms in early stages of disease. Fever and low energy is present sometime. It involves extra-articular organs in 15 to 25% of the cases. Besides the joint, other organs are also involved. Joint becomes swollen, tender, warm, and painful. Monoarticular disease is initially, then it involves the both sides joints. So here one can see the spine, the knee, the foot, the hand, and the hip joint are involved. So the rheumatoid arthritis usually affects joint symmetrically on both sides equally, may initially begin in a couple of joints only and not frequently attacks the wrist, hands, elbows, shoulders, knees, and ankle. Mostly these joints are involved like wrist, hands, elbows, shoulder, knees, and here one can see all these joints shown as a blue and symmetrically involved on the both sides of the body. Any diarthrodial freely mobile joint may be affected, and PIP joints of the finger, that is proximal interphalangeal joints of the finger, and MCP joint, metacarpophalangeal joints, and MTP, metatarsal phalangeal joints are most often involved. Symmetrical multiple joints are affected and causing polyarthritis. Large joints like shoulder and knee can also involve. These signs distinguish it from the non-inflammatory problem of the joint, such as osteoarthritis, as no signs of inflammation and early morning stiffness is seen, as in case of rheumatoid arthritis, which is seen in this case. The pain in the rheumatoid arthritis induced at site of the inflammation and called nociceptive as opposed to the neuropathic. Now, there are certain extra-articular features of the rheumatoid arthritis. These are constitutional symptom, skin involvement, eye involvement, blood is involved, heart and blood vessels are involved, lungs are involved, kidneys, malignancy, liver, bones, and neurological involvement is there. So, first we are going to constitutional symptom. It include fatigue, low-grade fever, malaise, morning stiffness, loss of appetite, and loss of weight in active rheumatoid arthritis. Number two is skin present with subcutaneous nodules. Rheumatoid nodules present in the skin in 20 to 30% of cases. These are from few millimeter to few centimeter in diameter, found over bony prominences like elbow, heel, knuckles, bursae, and tendon sheaths. These are also seen in lungs, sclera, and other tissue. Sometimes the palmar erythema, small vessels, vasculitis, as the tiny hemorrhagic infarcts in the nail folds of the finger pulse are also seen as one of the manifestations of skin. So here one can see the common site for the rheumatoid nodules. These are elbows and the fingers. I have told you metatarsophalangeal joint and PIP joints and other smaller joints are involved. And here one can see near the elbow the rheumatoid nodules are seen, and that is the palmar erythema, part of the skin manifestation, and similarly that is the vasculitis seen in rheumatoid arthritis. Now, continuing the skin, later medium-sized vessels, rheumatoid vasculitis present with the skin ulceration. I have already shown you the slide. Other rare skin problems include pyoderma gangrenosum, sweet syndrome, drug reaction, erythema nodosum, low paniculitis, atrophy of the finger skin, and skin fragility, and diffuse alopecia areata is also the manifestation which is seen when the skin is involved in case of rheumatoid arthritis. And the third involvement is eye symptoms. These are sicca complex, dryness of the eyes, mouth, and the other mucous membrane, which is the part of the Sjogren syndrome. And in the eye, episcleritis, scleritis, and scleromalacia due to the scleral nodules has been seen as the eye symptom. So here one can see the diffuse alopecia of the skin involvement, pyoderma gangrenosum, also the skin involvement, and this is the sweet syndrome, which have been also seen in rheumatoid arthritis. One can see the lesion of the sweet syndrome. Then there is erythema nodosum, as one can appreciate there, and here is lobular paniculitis, that is in leg, one can see that is the lobular paniculitis. Now, here in case of the eye, there is episcleritis and scleritis that one can appreciate here, and also there is uveitis, that is also the inflammation of the uvea. In case of the kidney, there is amyloidosis of the kidneys, and there is anemia of rheumatoid arthritis, that is the low blood hemoglobin level, that is the anemia manifesting because of the rheumatoid arthritis. Now, the fourth involvement is the blood. Anemia, chronic inflammation in rheumatoid arthritis leads to the anemia of chronic disease. Here, iron is poorly absorbed and it enters into the macrophages, so the macrophage take the iron and not available for the blood to make more hemoglobin and leading to the anemia. Red cells are normocytic and normochromic, and there is decrease in the TLC also, causing leukopenia, and lymphadenopathy is also present. The fifth involvement is heart and the blood vessels. The patient prone to atherosclerosis, pericarditis, endocarditis, vasculitis, left ventricular failure, valvulitis, and the fibrosis seen as the manifestation of rheumatoid arthritis. Rarely, necrotizing arthritis, aortitis, late complication that causes aortic regurgitation. So here one can see the heart inflammation, that is pericardium, and inflammation is called pericarditis, and there is bacterial endocarditis, and also there is heart muscle when involved, it is going to cause the myocarditis. And when rheumatoid arthritis may affect the lungs, it is going to cause interstitial lung disease, ILD. Then it can cause infection in the lungs. Then it can cause airway disease, and one can see the narrowing of the bronchioles, and then the rheumatoid nodules seen on the lung, in the lung, over the lung surface, and also it is going to cause the pleurisy, which is the manifestation of the rheumatoid arthritis. Now, sixth, I have already told you, the lungs, lung fibrosis, rare but result of the therapy with methotrexate and leflunomide that leads more to the involvement of the lung when these drugs are being used. There is exudative pleural effusion also seen, I have already shown you in the previous slide. And the kidneys, I have told you, the renal amyloidosis occur in the untreated chronic inflammation. Treatment with penicillamine and gold salts are causes of the membrane nephropathy. And the eighth feature is malignancy. The incidence of the lymphoma is increased. It is associated with the chronic inflammation leading to the lymphoma. So here one can see what happens in case of the liver. Normally, the immune cells are capable or responsible for attacking viruses and the bacteria, and there are the healthy liver cells not attacked by these immune cells. But in case of the autoimmune hepatitis, immune cells attacking the liver cells by mistake, and here one can see the immune cells are attacking the liver cell previously which were healthy. And there is the bone involvement in which the bones are going to have osteoporosis, and rheumatoid arthritis is going to have the effect in osteoporotic bone more. So here is the liver. Liver problem is due to the underlying disease process due to the medication used to treat disease causing the hepatomegaly. I have already shown you the immune cells attacking the liver. A coexisting autoimmune liver disease such as primary biliary cirrhosis or autoimmune hepatitis may also occur. That is autoimmune hepatitis I have shown you in the slide. In case of the bone, I have already shown you local osteoporosis around the inflamed joint caused by the inflammatory cytokines. Other reasons are immobility and corticosteroid therapy, which also promote the osteoporosis and the rheumatoid arthritis. The 11th feature of rheumatoid arthritis is neurological. There is peripheral neuropathy and mononeuritis multiplex may be seen, and due to the vasculitis and the nerve infarction, most common is carpal tunnel syndrome and the compression of the median nerve by the swelling around the wrist. So here one can see the neurological manifestation of rheumatoid arthritis, and there is also one can see the carpal tunnel syndrome in which the healthy carpal tunnel is there, and here the carpal tunnel syndrome is causing the compression on the median nerve which is passing under that, and that is the complication of rheumatoid arthritis. Here one can see the median nerve is passing very smoothly, and here median nerve is being trapped and compressed by the retinaculum, and it is the complication of rheumatoid arthritis. Now, there are certain complications which occur because of the rheumatoid arthritis. These are the synovial cysts and the rupture of the tendons, entrapment syndrome, median nerve at the carpal tunnel of the wrist. I have already shown you that can affect neck but spares spine and sacroiliac joint. Then synovitis leads to the tying of the tissue, loss of the movement, and the erosion of the joint surface, causing deformity and the loss of function. The fingers suffer always. The fourth complication is valgus deformity of the knee. The fifth is swan neck deformity. There is hyperextension at the proximal interphalangeal joint and the flexion at the distal interphalangeal joint, leading to swan neck appearance, so that it is called swan neck deformity. Then sixth is volar subluxation of the metatarsophalangeal joints. So here one can see the synovial cyst which is being formed as rheumatoid arthritis complication, carpal ligament and the median nerve. I have already shown you that is just compressing the median nerve, and there is entrapment of the median nerve. Here it is the swollen and inflamed synovial membrane, as one can see, that is inflamed and swollen synovial membrane. And here there is valgus knee that causes abnormal posture, and that also lead to put stress on the joint and ultimately causing the rheumatoid arthritis. And here one can see the metatarsophalangeal joints, these are involved, and also the proximal interphalangeal joints are involved, and distal interphalangeal joints are also involved as part of the involvement of rheumatoid complication. The seventh complication is specific deformities that include ulnar deviation of the fingers, buttonhole deformity, also called buttonhole deformity. There is flexion of the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint of the hand, causing all these deformities. Then the eighth is Z thumb or Z deformity. There is hyperextension of the interphalangeal joint and the fixed flexion, and there is subluxation of the metacarpophalangeal joint and gives a Z appearance to the thumb. Ninth is the hemato deformity is also seen, and the tenth is the worst case joints called arthritic mutilans due to the mutilating nature of the deformities, and that causes the mutilation of the fingers. So here one can see the rheumatoid arthritis and the later stages, buttonhole deformity of the thumb, as one can see the ulnar deviation of the metacarpophalangeal joint. It means that is deviating towards the ulnar bone. Then swan neck deformity of the fingers. There is also one can see the interphalangeal joints are involved. And there is metacarpophalangeal joint, and that is the hemato, the proximal interphalangeal joint of the finger is involved, and that is flexion causing the appearance of hemato. Z deformity of the thumb, as one can see the interphalangeal flexion, metacarpophalangeal hyperextension, and there is CMC flexion. All this lead to form a Z-shaped deformity, and that is called Z thumb.